allow residents to enroll in plans on exchange, regardless of their immigration status. So before we get started, I just want to let everyone know we'll be recording this meeting. And I think Amelia has already started the recording. So I am Becca Lane. I'm the Senior Health Policy Analyst at the Maryland Health Benefit Exchange. I'm joined by Michelle Eberly, our Executive Director, and my fellow policy analyst, Amelia Marcus. We also have some colleagues from the Maryland Insurance Administration on the line, Brad Bobin and Adam Zimmerman. They're here if their expertise is needed. So just to get started, I'll just give you a quick rundown of how we'll handle today. I'll just be giving a quick overview of the reinsurance program first, because our 1332 waiver is the reinsurance program is our only program that is being facilitated by the 1332 waiver currently, and it just helpful context. Then I will talk about the application that we've drafted to request the waiver amendment, and we'll have some public testimony. I had circulated a Google form to sign up to comment, for people to sign up to comment, but if you didn't see that ahead of time, no worries, please speak up anyway. We want to hear everyone today. So to get started with background on the reinsurance program, so as you may know, in 2014, the Affordable Care Act reforms went into effect, and rates ended up doubling between 2014 and 2018. Enrollment also declined as a result of that. So in 2019, Maryland implemented a reinsurance program to stabilize individual market rates, and that's the 1332 waiver is what allows us to do that. So since 2019, the rates have gone down more than 20%, and enrollment has rebounded. So the reinsurance program is successful. On the next slide, I just give a little more information on how reinsurance works. Reinsurance is basically a program that allows Maryland to reimburse insurers for a portion of high claims costs. So lower costs allow carriers to charge lower premiums to enrollees. And then the way that we decide how much to pay is determined by parameters that the MHBE board sets each year. So what happens is between the attachment point, which is the point at which payment begins, and the cap, which is the point at which payment stops, the state reimburses carriers for a certain percentage, a co-insurance rate. In all years of the program so far, it's been 80%. So for 80% of costs, the state will reimburse carriers for claims between the attachment point and the cap. So in 2024, that was claims incurred between $20,000 and $250,000. There's also something called the dampening factor, which is just meant to account for the interaction between the reinsurance program and the federal risk adjustment program. These are both programs that cover claims for high cost individuals. So this factor is just a way to correct for any overlap. On the next slide, I'll just give you a sense of the size of the program. So in 2023, the amount that was paid by the reinsurance program was about $566 million. We received $473 million in federal funding. I'll talk more about funding later. And then of all individual market enrollment, only about 7% of enrollees had claims reimbursed by the program. So that's about 16,000 individuals. And then the rest of individual market enrollees did not have claims reimbursed by the program. So 93%, or about 220,000. On the next slide, so in the market overall, total paid claims were about $1.6 billion. And so, as I mentioned, most enrollees do not qualify for reinsurance payments. So that 93% accounted for only 31% of all paid claims in the market. And then the 7% who did qualify accounted for 69% of paid claims. So the reinsurance program ended up reimbursing about half of those claims at 35%, and then insurers covered the rest of that at 34%. On the next slide, I just want to show how premiums have been reduced under the reinsurance program. So like I mentioned, premiums are down more than 20% compared to before the program. And then our plans in Maryland are about 25 to 30% below US averages, depending on the metal level. And then also enrollment on the next slide continues to grow. On exchange enrollment is up 36%. Off exchange is up almost, or not off exchange, but both total and total enrollment, including on and off exchange, is up almost 33%. We can't say necessarily that that's all due to the reinsurance program. It's also attributable to the enhanced federal premium subsidies that are in effect through the American Rescue Plan Act, and then also Medicaid disenrollments that happened in the past year. So all those things contribute to enrollment growth. And then just quickly on funding, we use both state and federal dollars to fund the reinsurance program, and the state portion of funding comes from an insurance provider fee. Right now, it constitutes about 1%. And then federal funding, this is where it's important context for the waiver. So through the 1332 waiver from the government, so the federal government subsidizes, obviously, individual market premiums so that people don't end up paying more than 8.5% of their income. If what we do under our waiver saves the federal government money, and reduces the amount that they have to pay to subsidize people's premiums, those savings get passed on to us, and we call that federal pass-through funding. And this comprises a significant portion of our funding for the reinsurance program under the waiver. So the concept of pass-through funding is relevant context for the amendment application that I'll talk about. And then this slide just shows the kind of funding outlook through the end of the waiver period. If you're interested in more on reinsurance, please come to our reinsurance annual forum on the 16th. You can find information about it on our website. But this just shows that in the first few years of the program, we had a lot of federal and state funding exceeding the cost of the program. Then in 2022, we had to draw down on our reserves. Considering all of this, by the end of 2028, we will have about $288 million left. And there's some assumptions in here, that the attachment point will increase by $1,000 a year starting 2025, and that the enhanced premium subsidies will end in 2025 as well. If they are extended, we'll have more funding left over. So anyway, this is reinsurance. I can move on now to our waiver amendment application. So the waiver that facilitates everything I just talked about is what we are requesting to amend to allow all individuals to enroll regardless of immigration status. So the contents of the application are here on this slide. They are dictated by the application requirements by the feds. So I'll just start in on the background. The first section of our request just describes the kind of state context. So how the Maryland General Assembly passed the Access to Care Act and directed us to apply for this waiver amendment to allow all residents to enroll regardless of their immigration status. This is a waiver of Section 1312F3 of the Affordable Care Act. And as I just discussed, we have an approved Section 1332 waiver, facilitates the reinsurance program. So what we are doing here is requesting to add this additional waived provision, Section 1312F3, through the remainder of the waiver period starting in 2026. And then we anticipate that the new rules will be in effect for 2026 plans, in time for an open enrollment for 2026 plans. In our description and background section, we also note that over 100,000 Marylanders are uninsured and ineligible for coverage due to their immigration status. That's a pretty significant portion of Maryland's uninsured population at 30%. Right now, as you know, these individuals are not eligible to enroll on exchange, and that's just because of their immigration status. But they are eligible to enroll in off-exchange plans at full price currently. If the waiver amendment is approved, we would be allowed, or these individuals would be allowed to enroll in private plans on exchange at full price. And unfortunately, these individuals would not be eligible for federal or state subsidies. However, on the next slide, we point out the benefits of on-exchange enrollment in the absence of subsidies for this population. So the main one is simplified shopping experience. So we have a lot of tools on Maryland Health Connection for comparing plan costs, for helping individuals check whether the plans they're considering include their providers or prescription drugs that they use, and then also estimate total costs. The exchange offers extensive consumer support. We have more than 200 languages represented in the call center, and then in person, individuals can receive assistance through the Navigator program and through brokers. Another benefit to enrolling on exchange is that mixed status families be able to enroll in the same plans. This will promote continuity of coverage and care coordination. It'll allow families to share a single deductible and out-of-pocket maximum, and just reduce the burden of managing multiple plans. So the public comment period, this is what we're doing right now. It's been 30 days. It's going to end on the 9th. During this 30-day period, this again is the second of 2 hearings, and we had published notice of this on our website. We've received many public comments, which is wonderful. We'll be including a summary of those comments in the final submission of our application, as well as the presentations and minutes from these meetings, and the comments themselves. We also, in our application, make sure to address the evidence of sufficient authority under state law. So this section just talks about how one piece of legislation in 2018 directed us to apply for the 1332 waiver and to establish a reinsurance program. And then in 2024, the Access to Care Act builds on that, directing us to apply for an amendment to the waiver. So on the next slide, we submitted an implementation plan for this new program as well. We have requested that CMS respond to approve or deny our request by the end of this calendar year, but they do have until February 25th, or as long as we submit along the timeline that we've been working along so far. Then in March through August, we anticipate our IT team to design the system changes necessary to facilitate this new enrollment, and then finalize updates and complete testing in the summer of 2025, so that everything is ready for fall open enrollment activities and support implementation in 2026. So, yep, and I think I've addressed all those pieces. So the a key part of this application is the analysis of impact on what's called the statutory guardrails. So we, in order to have our request approved, we needed to show that we fulfill all of these principles here. So the first is comprehensiveness. This is just that under the waiver, coverage must be as comprehensive as it was without the waiver. We anticipate this not having an impact, or new program not having an impact on this guardrail, because we're not requesting any changes to the comprehensiveness of coverage. Affordability. So we have to show that that under the waiver, the coverage and cost sharing protections are at least as affordable as without the waiver, and the proposal would not change enrollees' out-of-pocket costs or raise premiums. So we are fine on that one as well. Coverage is just about providing coverage to at least a comparable number of residents as without the waiver. We in our analysis show that this would not impact coverage of those who are already eligible without the waiver amendment. And then in addition, newly eligible enrollments will lead to an increase in coverage. And then lastly, we have to show that the amendment will not increase the federal deficit. And we show how the amendment will actually immaterially reduce premiums, reducing the federal APTC liability and the federal deficit. So we, our analysis shows that we are in compliance with the guardrails. As I mentioned on the last slide about the immaterial reduction in premiums, our analysis, shows that we expect this immaterial reduction. So this is because research indicates that those who are eligible, but for their immigration status, are healthier than the general population, and that they are also kind of younger overall than in the individual market overall. So we don't anticipate much of an impact from anti-selection or pent-up demand because of the prior availability of off-exchange plans to this population. And then lastly, although we show this reduction in the federal APTC liability, we are not requesting pass-through as a result of this waiver amendment. So the timeline for these activities, as I mentioned, we're in the 30-day public comment period, and the next stage is for the board to vote to submit our application, and that's happening on Monday, July 15th. The board will vote to allow us to do this or not. And then the federal government has 45 days to determine whether our application is complete. They will hold their own public comment period, and then they have up to 180 days from the date that they determine our application is complete. And again, we've requested that determination by the end of 2024. We hope that happens, but they're not obligated to do that for us. And then, as I mentioned, open enrollment starts November 1st, and then plans will be effective on January 1st, 2026. That concludes my presentation today, and I would love it if people would provide some public comment. I think we have a few people signed up already, so I can start by calling on people, and then we can have anyone else who's interested speak up at that point. So I will start with Sally Ann Alborn from the Maryland Community Health System. Sally Ann, are you here? Would you like to provide your comment?
I am here. Good afternoon. As many of you may know, Maryland Community Health System, which is a network of 7 federally qualified health centers with 55 locations across the state, supported House Bill 728, Senate Bill 705 enthusiastically. We're delighted to be with you today to also offer our support for the waiver amendment. As we mentioned during the legislative session, there are about 225 undocumented people in Maryland, of which 71% of them are employed. However, 55% of them are uninsured. And we feel this opportunity to purchase insurance coverage on the Maryland Health Benefit Exchange at no cost to the state provides them an opportunity to have access to a full range of healthcare services, such as primary care, specialty care, hospitalization, ancillary services, etc. As many of you know, FQHCC patients, regardless, that are presented to us regardless of their ability to pay. And we have a sliding fee scale from 0 to whatever the patient is capable of paying. However, our primary care services don't extend to being able to provide a more comprehensive package of services such as hospitalization, X-ray, specialty care services, etc. We avail our patients of every service that we have available, but we don't have. We provide primarily primary care. So we feel that this is the right thing to do. And that was our support during the legislative session. That is our primary message during today's hearing. However, I do want to make the point that most of our sliding fee scale patients predominantly are uninsured, are also undocumented, and are on a sliding fee scale. They only pay about 10 or 20% of their of the total cost of the visit. And for us, this results in an increasing level of uncompensated care. For our 7 FQHCs alone, that annually is tens of millions of dollars. We make an enormous contribution in services to the Maryland healthcare system. And frankly, whatever we can do to reduce that by giving people an opportunity to actually buy coverage and have coverage for their healthcare needs will help contain our growing uncompensated care costs and allow us to see other people who have no access whatsoever to to buying coverage. So with that, Maryland Community Health System urges support for this waiver amendment. I'll be happy to answer any questions.
Great, thank you. If there are no questions for Sally Ann, next up is Robin Elliott, representing a number of entities.
Great. Thank you, Becca, and thank you, Sally, for your kind words. And my colleague, Michael Patty, and I are sharing a link today. We're in a meeting, but I'm here on behalf today of the Maryland Assembly of School-Based Health Centers, the American College of Nurse Midwives, and the Maryland Academy of Physician Assistants. Really echoing Sally's comment, these organizations support this waiver, supported the legislation that led to the waiver request, because it is the right thing to do to provide opportunity to people to take control of their own lives and be able to use their own money to purchase insurance. I wanted to thank the Maryland Health Benefit Exchange. One of the reasons that this legislation and this waiver can work is all the incredible work that the exchange has done in creating a system that is consumer friendly. And it's just absolutely amazing, because navigating the insurance world is not easy, and it's not easy for anyone, and particularly challenging if English is not your first language. And we heard that over and over again as a theme during the legislative session, and I think it's really important also to raise at this point in the process. And the last thing I wanted to mention, very similar to what Sally said, that school-based health centers, there are 89 of them across the state, and they are in areas and schools which there are economic challenges, where there are high rates of uninsurance and people who are covered under Medicaid. These 89 school-based health centers really struggle with sustainability. And one of the primary reasons, just like the federally qualified health centers, is to serve everyone. And many of the students in these school-based health centers who don't have insurance do so because they themselves do not have documentation, or it may be they are legal status themselves, but one of their parents isn't, or a family member in their household isn't. So that really, I think, creates a hesitancy potentially about people enrolling in insurance, even if they legally could. And so creating an opportunity for really the whole household to gain coverage is just an incredible opportunity. And I really want to thank, there are a lot of people on this call who helped make it possible to get to this moment. And I want to thank the exchange for all the work I know in putting together the waiver amendment and also navigating the federal process that I know we're just about to embark on. So thank you.
Thanks, Robin. I see Michael Patty also signed up. Michael?
Thanks, Becca. Just wanted to, oh, there we go. Just wanted to say thanks to MHBE. I'm here today on behalf of the Maryland Occupational Therapy Association and the Maryland Dental Action Coalition. I just want to say thanks for working with the Dental Action Coalition to make sure dental insurance isn't forgotten about when we talk about all the products that are offered on the exchange. Obviously, those standalone dental products are incredibly important to someone's health, and having access to that insurance is as important. Both MOTA and MDEC supported this legislation, and we're going to continue to support this process through the waiver. And I think Robin said it best earlier, so I'll just leave my comments there.
Thank you so much. That's all who signed up in advance. But oh, Sally-Ann, yes.
I would just like, again, to comment and reinforce what Robin Elliott said about obtaining coverage. We have a number of certified application counselors in our health centers, and work with the undocumented, uninsured population to try and get them coverage if we can, whether it's Medicaid or Medicare or some other form of coverage if it's available. And I will tell you, and also having been in the insurance business myself for nearly 20 years, it is very, very difficult for people in general, and for people for which English is not their first language, to navigate the system and fill out the application. And I've had a long experience with the exchange, as have the FQHCs, in referring people there. And I just echo what Robin said about the process they have and the navigation support that they provide, which certainly during the unwinding and in helping people we refer there, they're really, whether it's language or how they describe products, and it's a trusted source of insurance purchase coverage. And I just really wanted to re-emphasize that point, because it is such a dominant issue when we're trying to work with our patients. Thank you for giving me that opportunity.
Thank you. Now I'd like to welcome anyone else who would like to provide comment at this time.
Thank you, Becca. Do I need to raise my hand? I think I didn't do that.
No, please go ahead.
Hi, hello everyone. My name is Madeline Martinez. I'm here on behalf of Catholic Charities of Baltimore. One of our programs, Esperanza Center, serves as a primary healthcare provider for about 1,500 undocumented immigrants here in the Baltimore region. Most of our patients come with non-emergent conditions. However, if they wouldn't have access to our clinic, they would have to go the conditions would either go untreated or they would end up in the emergency room, which would contribute to the ongoing cost of care in our state. During session, Catholic Charities of Baltimore supported this bill because the passage of this bill would ensure that Maryland residents who are working and paying taxes can purchase insurance through the Maryland Health Connection. And we are here to support the waiver as well and to ensure that the provisions listed on the bill are included and to ensure that the bill moves forward, and so that in 2026, hopefully, we would have the opportunity to educate the people who come to Esperanza Center and the members we serve about the importance of enrolling and accessing healthcare, purchasing healthcare in Maryland. So we're very thankful to the Maryland Health Benefit Exchange. We know this work started a long time ago, and it's so exciting to see it here at this point. And thank you for the opportunity to provide comment today.
Thank you so much. Anyone else? Not seeing anyone else piping up, so I will just thank everyone for their comments. We really appreciate it. If you have anything else to say or anyone else has any other comments, please feel free to email me. There is an email address where you can send public comments in the on our website. You should be able to find our public comment email address. And thank you so much for your time today. And I will end this call if there are no other comments. Thanks, everyone.